Okay, hello everybody. For those of you who don't know me, my name is Dr. Daniel Marston. Okay, hello everybody. My name is Dr. Daniel Marston. For those of you who don't know me, I know several of you I've had in class before, but not all of you. And welcome to the course Psychological Testing and Assessment. Every week, the lectures for this course will be split into two. One will be a video lecture that I record like this one, and then there will be a live lecture. That live lecture will be via video, and it will be from 5:30 to 6:30 Pacific Standard Time. And I apologize, the reason, many of you know this, the reason why I had to think through that is because I am on the East Coast. I'm near Pittsburgh, Pennsylvania. And I know that many, if not most of you, are in California where the school is. So there is a 3-hour time difference. So your 5:30 is my 8:30 p.m. So I always have to prep 8:30 my time, 5:30 your time. I do realize that is what the class schedule for CIHS says, and that's what you should know by. So I do realize that the CIHS schedule said 5:30 to 6:30. I do realize that the syllabus was wrong. The syllabus says 4:30 to 5:30. That was a mistake, correct, but it's 5:30 to 6:30 Thursday nights. And the reason I can't make that 4:30 to 5:30 is I also have a 4:30 to 5:30 class. As I said, my name is Dr. Daniel Marston. I'm a clinical psychologist out near Pittsburgh, Pennsylvania. I have been teaching at CIHS for a few years. This is well, I'm going to talk about how often I've taught this course. This is the second time I've taught this course, but it's going to be slightly different from the first time. Quite a bit different from the first time. I'll explain that in a minute. Just tell you a little bit more about myself. I'm a clinical psychologist out in Pennsylvania. I just recently also got a license in Ohio, so I'm a licensed psychologist in the states of Ohio and Pennsylvania. I specialize in cognitive behavior therapy. I am board certified in it by the American Board of Professional Psychology. Clinical psychology is my specialty. As far as academics go, I have a strong interest in research design, statistics, human ethology, and the intersection of the study of animal behavior and human behavior. Basically, what the study of animal behavior can tell us in terms of understanding human behavior. Human ethology is a type of research approach that was developed from animal research. Ethology is basically the type of research that focuses on behavioral observation, not tests, not interviews, but behavioral observations. That's the sort of research I like, that's the sort of research I personally am interested in conducting, although I also specialize in all different types of research design. I've taught courses in research design and statistics. I have 2 books published on the intersection of empirical research and clinical work. I have a number of articles, that sort of thing. That's just to tell you a little bit about myself. So now to tell you a little bit about this course. When I mentioned before that this is the second time I have taught it, and I said this is going to be different, one of the reasons it's going to be different, there are actually a few students in here who took it the first time I taught it. This course is going to be different enough that it is worth students who took it the first time to take it again, mainly because of the test we will focus on. Okay, so let me tell you about the course. This course will focus to a large extent on helping you, on on educating you on how psychological tests work. I get asked a lot about what tests we will study here, and certainly that is going to be, we will focus on specific tests in here. But one of the main purposes of this course will be to help you understand how psychological tests work. One of the biggest goals of you taking this course is not necessarily to understand specific tests, although that will be a big part of it. It will also be for you to understand enough how psychological tests work that in the future, as you become licensed professionals, you will be able to make your own judgment about whether a test is worth using, whether you want to use it, and go and find your own way of getting trained on how to administer the test. Just to give you an example of how that works and what the sort of level we're trying to get you at is, as I said, I'm a licensed psychologist. Recently, there is a test, the most widely used test called the MMPI, which we will talk about in this course. The MMPI-2 was used for several decades. I used it, and in fact, it was part of what I taught in the last course. The MMPI-3 came out just recently. For those of you who took the first course, you heard me say on many different occasions, I really, really do not like the MMPI-3. I think it is a completely different test than the MMPI-2. I think they took everything that made the MMPI a very, very useful and rather unique instrument and just discarded it and made it a completely different test. Why I bring that up is because I am now in the process of having to make my decision of, in my psychological assessment, would I replace the MMPI-3 with? So there are other options from the MMPI-3. Because I am a trained licensed psychologist, I am the one who is making my own decision about what test I use. I'm getting advice from other people, getting input from other people, but the decision is mine. And once I do that, I will educate myself on how to use it and obtain my own training on how to use the instrument. I can do that because I understand how psychological tests work. I understand what to look for. I understand how they are developed. I understand how tests are developed enough that I can make my own decision about whether I think a test is a good one to use. I'm not needing someone to tell me what the test is, what decision I should make about the test. That is where we want to get all of you at. By the time, once you get licensed, that you are competent enough at understanding tests to make your own decision about whether a test that you haven't used yet is one that you want to use. How you go about getting sufficient training in the use of that test. So all that is a way of just underscoring why one very important part of this course will be to get you to understand how psychological tests are developed, how they work, how you understand them. Those of you who took this course before and realized we covered that there, it will still be important material to go through again here. And we will be looking at it from a different angle, because in the context of understanding psychological tests, we will delve into two specific instruments. So we will talk about a number of different tests, but we will focus on two as a way of really delving into not only understanding a test, but also looking on a practical level how psychological tests work. And the two I have decided to use, I made this decision based on a similar decision I made in the last class, the last time I taught this course, which is we will be focusing on one, what is called objective test, and one, what is called subjective test. The difference between them is an objective test, is a psychological test where you interpret based on normative data. In other words, the objective test is one where the way the test is developed is or the way the interpretation method is developed is the test is developed. It is given to thousands of people, but in a well-researched test, that's how it's given to thousands of people. And then the norms are based on the results of it being given to thousands of people. So for instance, if you say that a certain score on the test is average, that's because of the thousands of people who took the test. That was the average score. So the determination is that the average score that one should expect is one that is similar to the average of the group of the thousands of people who took the test. So an objective test is based on normative data. It is based on statistical outcomes about what an average score is, about what an extreme score is, about what a below average score is, and what a significant below average score and what a significant above average score is. Examples of objective tests include the MMPI. The MMPI is interpreted primarily, MMPI is made up of several hundred true or false questions. And they're not questions, they're statements. So they're statements and the person says whether it's true or false about them. And then there are a number of different scales, and the scores that the person gets on those scales is based on the original thousands of people who took the test. And so, for instance, a score on the MMPI-2 on what is called the depression subscale, determining whether a person is depressed, is based on whether that individual gets a score that were similar to what depressed people who took the original, who took the MMPI when it was developed, whether it's consistent with those scores. So basically what happened, for instance, with the MMPI and the depression subscale is thousands of people who were depressed took the test. Thousands of people who were not depressed took the test. The developers of the test figured out what scores on what items did the best at distinguishing between the group of people who were depressed and the group of people who weren't depressed. There were people they knew had depression, people they knew didn't have depression. Both groups took the test, and then the items and the score on those items that best separated, that best distinguished those two groups made up the depression subscale. And so when someone takes the MMPI, if they score on those items similar to how the people who were depressed scored, then it is said that they score high on the depression subscale, and that's evidence that they have depression. That's how an objective test works. A objective test is based on statistics and normative data. Now, we will be talking about the MMPI-3 in here, but it is not the main test that we will be using. There are several reasons for that. One is because the first time we taught this, we did the MMPI-2. My opinion, other than just really not liking the MMPI-3, is that the and that's one reason I didn't want to use it, but it is still a commonly used test. And we will talk about the MMPI-3, but another reason I didn't utilize the MMPI-3, and I figured this out when we did the MMPI-2, is it is not a particularly difficult test to learn how to use. We will talk about it here, but really the MMPI-3 basically comes through, you give the test to individuals, you make sure the the testing environment is quiet, and the person can't, you make sure there's no distractions and stuff. I can make sure the person doesn't have their phone, because they could look up the answers because people post it online. And then they just take it. And then you take the result, and basically you get a computer scored. And then the computer score gives you a basis for interpretation. Now, you still have to understand the scales, and you still are expected to know where that interpretation comes from. But once you get the score, it's pretty easy to interpret the MMPI. The MMPI 2 is the same as the MMPI. I have a manual back here. I haven't got one for the MMPI 3. I have a manual back here for the MMPI 2. And all that happened was I would figure out, I would get, when I gave the MMPI 2, I would give to somebody, they'd fill out the 500 plus questions. I would get it back. I would send it to a computer scoring company. They would score the scales. I would find out what scales the person had the highest for. And then I had a manual where I would just look up what the scores meant. So it really isn't, it's worth knowing, but it's not the hardest test to learn how to use. So I chose instead to make the objective test that we focus on here the Wechsler Adult Intelligence Scale. It's an IQ test. And I do think it is useful for students who have familiarity with IQ tests. So we will be using, that will be the objective test that we use in here. It is the Wechsler Adult Intelligence Scale, 4th edition, the WAIS 4. Now, one side note here. I told you that there are several students in this course who took this course before. My understanding, and I was approached on this the other day, is that CIHS is pursuing the possibility of having just standard 2 sections of this course. Basically, you would take 2 semesters of psychological testing, because there's a lot of agreement that you probably should have a lot more exposure to psychological testing than you do. If that is done, and I am the one teaching both courses, I will plan to cover the MMPI 3 and the other one, even though I'll probably do it in the context of talking about other tests similar to the MMPI 3. The MMPI 3 is considered a personality test. In fact, that's what the PI stands for, personality, in the MMPI, the personality inventory. It is basically seen as an objective test that covers a number of different areas of a person's personality, as opposed to just one area. It covers depression, anxiety, alcoholism, schizophrenia, paranoia, all sorts of personality characteristics, as opposed to other tests which will just cover one. So it's pretty all-encompassing when it comes to personality. It's not the only one that is, it is not the only personality inventory out there. And there are others. The personality assessment inventory is another one, the PI, the Milan, MILLON. Those are other personality inventories, which are one of the benefits of those two is they're considerably shorter. The MMPI 3 is 500 plus items. The BAI and the Milan are both 200 or less items. So now, talking about personality inventory leads me into the second test that we will be using in here. Because I told you I picked one example of an objective test, that's the Wechsler Adult Intelligence Scale. And then the other test that I'm using is an example of what is called a subjective test. And a subjective test is one where the interpretation is based more on the professional's understanding of psychological theory, personality development. It is based much more on the professional's subjective view based on their training. It is much more focused on whether you as a psychologist understand and how you understand personality development, personality theory, theory of psychopathology, theory of psychodynamics, how generally we all function as human beings. So it is much more of a subjective view from the professional of how the test results should be interpreted. So typically with a subjective test, the psychologist does not go to norms; they go to making their own interpretation of what the test results mean. Now, it's not purely one way or another with subjective tests, because with the test we will be using, with the example of the subjective test we will be using here, there are norms, but the norms are only seen as one part of the assessment. The psychologist is also expected to do their own interpretation of what they think the results mean. So the norms are more a starting place rather than the whole story. So why I had said before that when I talked about personality testing, it was sort of a segue into talking about the second test we will be using. That's because the second test we will be using, the subjective test, is also seen as one that assesses overall personality. There's many different areas of human psychological functioning that is covered by this test. And the test we will be using here is the Rorschach, which is also known as the ink blot test. In the previous course, we used another subjective test called the thematic apperception test, or the TAT, which is similar to the Rorschach in that it uses cards, but the cards in the TAT are pictures as opposed to ink blots. I have the Rorschach here, so let me show you a couple. The most famous one is, so this is how the Rorschach works. A series of cards, and each card has an ink blot on it. So this is one, I think you can see here, this is the first one. And so you basically would show the person the picture and ask them what they see. What do you see here? Then you would start to interpret what it means about what they say. Because if you really look at this, if you really were answering honestly about what is this or what do you see, the answer would have to be nothing. It's just an ink blot. But people see different things. And what they see in the picture what they see in the picture, even though the picture really is not anything specific, what they see when you ask them, the theory goes, tells you a lot about their personality. And here's the second card. I show you the second card just because some of them are black and white, some of them are color or have color in them. And by the way, when you there are different things you look for, and we will get to this as we talk about the Rorschach. There are different things that you look for in the test. You look for how does the person incorporate color. You look at how do they incorporate symmetry. Notice how with each one of them, there's a degree of symmetry on there. And by the way, if you look at the symmetry with this one and then this one, you can sort of see how the ink blots were originally designed. They were you can almost picture, you take a piece of paper, you right in the middle, you plop down some ink, and then you fold it. And so if you fold it and then you open it back up, you've got you got symmetrical halves. If you drop a bunch of ink right down the middle and then you fold it and you open it back up, you're going to have the same thing on both sides of the fold. And that's, you can pretty much see that's like, you can see that's what's happened here. Here's the fold, blob of ink there, folded. And then you've got these two sides on there. So symmetry, movement, you will hear me say this because I always like this example, because sometimes people will see movement in a picture, like say this is something. And as one professor told me, you know, if you show someone a picture and they say it's moving, unless the part is doing that while you're showing them, it's not actually moving. So if they see, if they say that it's moving, something in their psyche is seeing movement. Now, what I meant before when I said that a lot of objective tests aren't all or none when it comes to using norms. There is a normative system that is used with the Rorschach. It is just that the normative system is not, it's seen as part of the interpretive process, not the whole thing. And it's based a lot on gathering normative data about what people see. So for instance, the starting place with this card is, you know, they gave it to thousands of people and they found that that the most common thing people see is a bat. So if the person gives you a response and their response is that's a bat, that's an average response. And then there's just normal, you know, and then the normative responses, there was also data collected on, you know, what is the most common response for someone who's diagnosed with schizophrenia? What is the most common response for someone with depression? But like I said, that's considered to be only part of the interpretive method, not the whole thing. Okay, so that is considered to be, as I said, that's considered to be part of the process, not the whole thing. Now, the rest of it is that you as a psychologist look at how the person responded and what they seem to be looking at when they gave you their responses. And we will be talking as we move on how to approach that. Now, I know several of you, at least I heard from several of you, have taken courses in the Rorschach before. Not all of you, but I know some of you have. So I certainly would want to hear your what interpretive method you learn, because there are different ones. And the approach I want to try to take here is to incorporate as much as possible. Now, there are other objective tests. As I mentioned, there's the TAT. The thematic apperception test is very similar to the Rorschach, except it's actual pictures. But the pictures are given no context. They're just pictures. And then you're supposed to tell a story about what happened before, during, after, and what are the people feeling, and what are they thinking in the picture. And as I said, since there is no context to the story or to the picture, what story the person comes up with is considered to be very telling of the person's psychological makeup. There is another objective test called the sentence completion test. That is a test where you start off the sentence and then there's a blank, and the person taking the test is expected to finish the sentence. We will be talking in here about how the tests were developed. The Rorschach was developed exclusively as an objective test, and then the normative data was collected later. By the way, I forget if I said the name of the primary normative data used in the Rorschach. The name for the primary system where normative data is used to interpret or to help interpret the Rorschach is called the Exner EXNER system. Exner was the researcher who developed the norm. So in this course, we will be learning about tests and how tests work, while also learning in depth about the Rorschach and the Wechsler Adult Intelligence Scale. I do have the Wechsler Adult Intelligence Scale, but I didn't show that to you because it's actually very large. It's in a soup, and so when we get to the test, I would show you it in pieces. But I couldn't show you an example. With the Rorschach, every part is the only difference is what's on the card, but the cards all look the same as far as how they're set up. All the tests, all 10 of the tests in the Wechsler Adult Intelligence Scale are different. So I'm going to need to show them to you one at a time. But I'm looking right at it. It's right up on my shelf here. Okay. And the goal here, so the goal by the end of this course will be for you to understand psychological testing and for you to have a very thorough understanding, or as thorough as we can get you, of the Rorschach and of the Wechsler Adult Intelligence Scale. There are right now 6 students registered in this course, which is much larger than the last time I taught it, and well, not much larger, but larger. And we have a lot of ground to cover. So I need you to keep up with the readings. I need you to keep up with. I will send out articles. I need you to keep up with. I need you to be as verbal as you can, and as proactive as you can in letting me know what questions you're having, so I can incorporate answers into my lectures or post on the discussion board or something along those lines. It will be very helpful for me if by some means, like I said, whether it's on the discussion board, whether it's by email, if you can let me know what questions you want me to cover, what questions you're having as we move forward with this. I will try to, as much as possible, answer those questions in my lecture or on the discussion board. There will be a discussion board topic posted each week, but you also can use the discussion board to bring up questions or bring up issues you would like to discuss in further detail. Please make sure you read the syllabus before the first class. My email and phone number are listed there. My cell phone number that you can also text me at is 724-433-5467. 724-433-5467. You can reach me there or you can text me. I am not a full-time faculty member at the IHS, so if you need to meet with me, that's fine. But keep in mind, I don't have full-time office hours at CIHS, so it may be a few days before we can find a mutually workable time. So oftentimes it is better to email me, and then that way I can respond to your email as soon as I have the chance to. Please keep this in mind for the course. I do not record the lectures. I do not like recording them when we're all involved there. However, so for that reason, it's very important that you attend every class. If you know ahead of time that you can't be in a class, I am willing to consider recording it, but I want to let everybody know ahead of time, and I really prefer not to record the lectures. I just feel it's more free that way, and everybody can be more open and about what they want to talk. They're not worried about being recorded. Not that there's anything we discussed they get to worry about having recorded, but I just like how the flow works better if you're not being recorded. But I will record the class if it's necessary. And let's see if there was anything else I wanted to discuss. As I said, you will have this video lecture there. The video lectures will usually be a little longer than this one. I'm going to wrap this up in a few minutes. First one, I don't make the first one as long because we haven't met yet. I really want to meet you and get a feel for what sorts of things I want to focus on. Okay, I guess that's it. If I will look forward to seeing everybody on Thursday. And if you have any questions, please feel free to text me or email me. Okay, I look forward to seeing everybody on Thursday.